Good evening. My name is Dr. Victor Narcisse. I'm the Deputy Surgeon General of Alpha Phi Alpha Fraternity Incorporated, and here to discuss this evening with an incredible panel of individuals the issues of firearm violence in our community. As many of us are aware, firearm violence is a public health issue that affects so many of us. In 2022, 48,000 Americans died of firearm violence, approximately 1 every 11 minutes. Additionally, we all are familiar with the idea that firearm violence disproportionately impacts communities of color. So we wish tonight to discuss and develop work around equity and understand how to develop insights from those who've been impacted. So to moderate, we have tonight Brother Dr. Hakeem Stovall. Dr. Stovall is got his doctorate from Williamson University. Previously, he developed his bachelor's and master's from Cheyenne University of Pennsylvania, and his dissertation was on tertiary prevention, recidivism reduction, and the effectiveness of reentry agency and impact. And we wish to bring with him a whole host of individuals. We'd like to say have a good evening and have a great show. Brother Stovall.
Thank you, Brother Dr. Narcisse. Welcome, everyone. Pleasure to be here. Just a little bit of detail about myself in addition to what Dr. Narcisse was saying. Presently, I'm a postdoctoral fellow at Johns Hopkins University Center for Gun Violence Solutions. Been in law enforcement for about 15 years as a senior corporal with the Department of Corrections, focusing on youth and adult corrections. And also understanding firearm violence as a law enforcement experienced individual. And worked for several years with the Philadelphia and DC Medical Examiner's Office in Philadelphia, focusing on gun violence fatality review. I want to lean into the purpose of the panel. Our present focus is to address the present gun violence crisis happening here in the U.S. In June 25th, 2024, U.S. Surgeon General Dr. Vivek Murthy had declared gun violence a severe public health crisis due to its widespread impact on health and safety. I want to do a brief overview of today's agenda and objectives as it relates to focusing on this public health crisis. At first, I want to do some panel introductions. I want to set the context, focus on personal perspective, strategies and solutions, policy and advocacy, and then we're going to do some closing remarks. I'd like to start off by doing a brief introduction of our first panelist, Brother Dr. Chester Holland. He is of Iota Sigma chapter, Millersville University. He is presently a chapter member of OLA in Washington, D.C., and he is a research manager of Council of the Great City Schools. He has a background in sociology, public administration, and urban affairs. He also has expertise in education policy, equity in K-12 education, and data governance. Welcome, Brother Dr. Holland. Our second panelist is Brother Dr. Robert Louis Stevenson. He is of Gamma Nu chapter. He is the assistant professor at the University of Florida. He is a historian who specializes in African American and African studies. He has a research focus on slave ship resistance, diaspora studies, and Middle Passage history. He also has experience as an adjunct professor and assistant director of African American Ministries. Welcome, Dr. Rick Stevenson.
God bless you, man. Good to see you.
Our third panelist is Brother Dr. Oki Enya. He is from UMU chapter. He is a present member of PUL chapter. He is a health policy researcher with NIH, presently focusing through NIH with the All of Us Research program. He has a background in public health, biology, and health policy consulting. Dr. Enya is also a Congressional Black Caucus Foundation Health Policy Fellow with expertise in health equity disparities. Welcome, Dr. Enya.
Okay.
And last but not least, Brother Greg Jackson. who is of Iota Beta chapter. He is the present deputy director of the White House Office of Gun Violence Prevention. He is the former executive director of the Community Justice Action Fund. He has extensive background in community organizing, political strategy, and gun violence prevention advocacy. He also has experience in advising on gun violence prevention policies at the federal level. I would like to say welcome to all of you brothers. Brother Jackson, welcome.
All right, thanks for having me.
Brother Jackson, I wanted to get your personal perspective on your survivor story. Could you share a little bit about your personal experiences as a gun violence survivor? Discuss a little bit about your emotional and societal impact of gun violence on communities of color, and then also provide us with motivation for advocacy engagement in gun violence prevention efforts.
Yeah. Well, greetings, brothers. Good to see everybody. Again, just excited to be in communion with our folks and our family. For me, gun violence was always a very present threat. Even though I grew up in rural Virginia, I'll never forget in elementary school, I lost one of my basketball teammates during AAU to gun violence. And then just throughout the years, unfortunately, there were shootings and situations that happened from time to time. And I didn't think as much of it growing up in rural Virginia. My parents had firearms. My dad had a hunting rifle he handed down to me. But everything became very real for me in April of 2013 when me and my cousin, who's also a brother of Alpha Phi Alpha Fraternity Incorporated from Winston-Salem State University, and a few others were out celebrating his bachelor party. And we literally were leaving and we saw two guys in an argument and gunfire broke out. And I was shot and the bullet that hit me hit two arteries and nearly cost me my life. And I'll never forget that two big things. One was when I arrived at the hospital, I wasn't met with nurses and surgeons and healthcare. I was met with investigators and people who questioned me about my whereabouts and where I was. And while I was literally bleeding to death, I was defending my innocence while fighting for my own life. And I think that was really telling because unfortunately in America, we've too long looked at this as a crime crisis where we're so focused on solving the crime and not thinking enough about how do we save the life? How do we prevent violence in the first place? How do we keep people and help navigate them through care and trauma? And how do we make sure the cycle of violence is disrupted? And for too long, Americans looked at this as a crime crisis. And for me, I felt that firsthand. I'll never forget seeing my brother in tears and my parents sleeping by my bedside and just watching that ripple just flow throughout my family and my community. And then everything that I went through personally, from feeling like it was my fault and, that I had done something wrong or I deserved this or, even in the situation where there was a chance I wouldn't walk again, like what reality would that mean for me? And I think a lot of folks don't realize, but gun violence is actually the leading cause of newly disabled Americans. And so many of our Black and brown boys across the country are going through very similar situations where their lives are, if they survive, are turned completely upside down. I think the other thing I would just emphasize when you think about survival of gun violence, every year over 140,000 people are shot or killed by gun violence. This is now the number one cause of death for Black men. It's the number one cause of premature death for all youth, but it's been the number one cause for Black youth since 2006. And it's also the number two cause of premature death for Black women. And so this crisis is not a hot issue. It's not a social justice issue. It's not a civil rights issue. This is a survival issue for the Black community. And I saw this firsthand. And unfortunately, too many communities and too many of our families and neighbors and friends are going through the same situation. The last thing I will just share is, after I was shot and I recovered, I decided to pour my talents and interests into local government to help address this crisis. And in 2019, I lost a family friend to gun violence in Greensboro, North Carolina, and just saw firsthand how different the responses and supports are from city to city. And so that's where I pivoted to doing more national and federal policy change around this issue. But I also started mentoring young Black boys and some of the young guys in my community. And frankly, there were 27 youth that we mentored. And I'm sure many of you are in mentorship programs. But of that 27 youth that were part of what we call the Boys Institute, as part of the Creative School, 5 of them have been shot and killed since 2013. And these are kids who advocated on Capitol Hill. I mean, we just lost the great Sheila Jackson Lee. But if you look at pictures of her when she was advocating for gun violence prevention bills, in the background, you'll see young Black men. And I don't know what just happened to your life. But 2 of those boys who were in those pictures with her advocating for major national policy change were shot and killed within months after of advocating for change. And so this is really literally wiping out too many of us and causing so much harm and tragedy. And unfortunately, I experienced this firsthand, but I like to think of it as a blessing in its own way to help motivate me to continue to focus on this issue. So thank you.
Absolutely. Brother Jackson, I want to stick with you for a second and lean into policy and advocacy from your vantage point. I wanted to discuss about you operating as the Deputy Director of the White House Office of Gun Violence Prevention and the level of community engagement through your experience. Discuss the importance about policy advocacy in addressing gun violence and the overview of legislative efforts and policy recommendations. And then lastly, engaging communities and stakeholders and advocates in advocating for change. I know I gave you a lot, but could you give me a quick snapshot view from your vantage point?
Yeah. Well, look, on this issue, there's been a huge sea change in how this issue has been addressed at the federal level. There's a pretty infamous moment where George Bush Jr. was elected, and he was such a big NRA guy that the NRA said that, now that he's elected, we'll be working out of the West Wing. The NRA will be working out of the West Wing. And since then,
I think I might have lost camera.
Okay,
We see the total reversal of that, where literally there is now a White House Office of Gun Violence Prevention, the first one ever in history. But this didn't happen by accident. This happened because of literally years of movement building, of organizing, of advocating, from March for Our Lives to Everytown for Gun Safety to community justice to local survivors and mothers and family members that have lost loved ones who decide to stand up and push on their mayor and their governor and their members of Congress. And the really big sea change policy-wise really happened because of that increased activism. And so I know when I was shot in 2013, that was right after Sandy Hook, and there was a universal background check vote that failed. And this was after young kids were shot and killed in the suburbs of Connecticut. And we couldn't get one bill done with universal background checks. But then we fast forward to 2022, where after Uvalde, after Buffalo, and after Highland Park, we saw the first bill passed in 30 years, the Bipartisan Safer Communities Act, the first bill on gun violence in 30 years, which the president talks about religiously. This bill included universal background checks. It made gun trafficking a federal offense. It focused on domestic violence. It created resources for school safety, for community violence intervention. I mean, this thing had $15 billion in it, in addition to 7 major policy changes, including universal background checks, or as close as you can get without looking at family sales. And all of that was passed in 2022. And when you ask the members of Congress the difference, what they'll say is that back in 2013, even though they wanted to do something after Sandy Hook, for every 1 call they got in support, they got 7 calls against it. But in 2022, for every call that they got against it, they had 15 calls in support of this bill. And the clear difference between those 2 moments was not the tragedies, not the media coverage, not the social media era. The clear difference was the activism and the pressure that people put on members of Congress on both sides of the aisle. In 2013, we had 3 Republicans vote for this bill, which was much smaller. In 2022, we had 15 Republicans vote for this enthusiastically. I mean, I remember I was in the chamber when the Senate voted on this, and I watched Mitch McConnell in tears, and I watched him high five Mitt Romney after the bill was passed. I mean, these Republicans wanted to bring about change, wanted to vote on something, wanted to move forward with something. And when the Bipartisan Safer Communities Act was constructed, as aggressively progressive as it was in so many areas, it happened because we had such a larger movement of activists, and not just, young white kids from the suburbs, but mothers from inner cities and survivors and fathers and activists and leaders from all parts of the country. And so we're starting to see that trend all over the country. I mean, this year, 17 states passed major bills around gun violence. 43 states introduced new legislation. Last year, 30 states moved forward legislation. And all of this is adding up. In the last 3 years, we went from one Office of Violence Prevention at the state level to now we're at 12, right? Including our White House Office of Violence Prevention. And all of this is a direct result of the advocacy of the leadership. And most importantly, I think, is the ability to identify champions and lift them up. President Biden is an obvious champion. Vice President Kamala Harris is an obvious champion to these issues, and putting them in positions of power has made a huge difference. The last piece I'll just say before I step back is that all of this advocacy and this fight for policy change and resources in the communities most impacted, and victim services and community violence intervention, it's working. And that's the most exciting part about it. I mean, the steepest decline in homicides we've ever seen in American history was in 1996. And that was a 9% decrease in homicides. In 2023, we saw a 13% decrease. So we beat the historic levels of 1996 and had the steepest decline in American history. And right now, we're on pace to a 22% decline. In cities with over 1 million residents, the average decline right now is 42% from last year. 42%. You have places like Baltimore that have seen double-digit reductions year after year and now are seeing upwards of 40% reductions. You have places like Boston that has 7 homicides. It's Boston. Still poverty, still Black communities, still suffering, still tragedy, still trauma, 7 homicides. And because we're starting to invest, really apply and pass serious gun laws, but also invest in the communities most impacted, and the change is real. And so I say all that to say that the advocacy is working. And what we've learned is that when the people who are most impacted actually stand up and speak and fight for change, and they're embraced by our leaders in the political system, we can see real progress and results. And I feel like that's the era we're in right now.
I honestly believe that the rise in the impact of gun violence stem from the impact of the COVID-19 pandemic. Thank you, Brother Jackson. I really appreciate your insight on that. In reference to what you were saying, based off of the impact of COVID and the syndemic that had taken place in prior years, was a tremendous catalyst, and the rise of purchasing firearms and the violence, and so afterwards we start to see a decline, right? And and initiating a lot of the evidence-based practices and trends can definitely, or we're seeing a difference thus far at this point. And I commend you for all of your efforts that you're doing thus far. I want to lean into an understanding, a contextual understanding of gun violence as a public health crisis. Current statistics overall, approximately, the CDC has reported approximately 49,000 gun-related deaths happened in the U.S. in 2021, which would include homicides, suicides, and accidents. In terms of homicides in the U.S. In 2021, we had a sharp increase in recent years. Suicides, we've seen like about 23,000 suicides by firearm, making up about the majority of gun-related deaths. Now, in recent trends, as I spoke earlier, we can see a significant rise in gun violence starting in 2020, which was exacerbated by the COVID-19 pandemic. And in terms of regional differences, understanding in prior to the decrease, there were higher rates in urban areas compared to rural through rural areas that we've seen gun violence as well. Understanding demographic disparities, age and gender, young adults, especially males aged 18 to 34, are most affected among African American and Hispanic communities, which face higher rates of gun violence. And then also, in terms of demographic disparities, understanding the socioeconomic factors that coincide with understanding demographic disparities, which are higher gun violence rates in areas of poverty, unemployment, and limited education opportunities that follow. When we think about the impact of gun violence in our society, it puts an impact on the health and safety of others in terms of physical injuries, mental health issues, increased healthcare costs. When we think about community effects and the community impact that it has, it creates fear, instability, disruption of economic and social development in our affected areas. But through policy and prevention efforts, focusing through legislation, in some cases, some states are making efforts to mitigate circumstances where others are not. Community programming, effective interventions that we feel as though would be community-based violence interruption through youth prevention programs, or CVIs, which is an identified community violence intervention method. Understanding the emerging trends, technological use, advances in data analytics and technology such as ShotSpotter and other AI-related technological applications are being developed to help enhance ways to respond to gun violence. And then also emerging trend of the growing focus of mental health support into gun violence would be the specific areas that we need to understand as we focus into this mental health crisis of those specific areas. I want to go a little bit into understanding the historical insights in reference to the societal factors in violence prevention by bringing Dr. Robert Louis Stevenson into the fold to share his perspectives on impacts and historically how we got to this point. Brother Dr. Stevenson.
I got the floor. Thank you. Thank you so much, Dr. Jackson, for your transparency. As a historian, I'm always concerned about, first of all, how we use terminology. When we think about the terms gun violence, oftentimes it is connected to urban or Black communities. And I think that we need to broaden the perspective and look at gun violence as also the way that law enforcement has caused a number of murders, killings in our homes. That gun violence is not just about Black on Black crime or Black on brown crime, but it is a matter of looking at how people look at one another. So one of the things I would argue then is as early as the 1600s, Black people were prohibited from owning firearms so that white people could have firearms and destroy our community. So gun violence is not necessarily something that is limited to our community or our perspective. In 1669, there was a law called the Casual Killing Act, where if an African enslaved person ran away or resisted, they could be killed, and then the owner could be paid for. So gun violence is not just about what we hear today. And so when I think about this notion of gun violence, the first thing I want to argue is that taking away firearms is not going to change the amount of gun violence we have. What needs to change is the way we see each other. We are taught to be suspicious of one another. based on complexion, based on attire, based on hairstyles, based on language. And so if you take a firearm and you just set it on the table, it will not shoot. It will not go off. Matter of fact, I have several firearms. I'm a firearm safety instructor. And if I say gun shoot, it won't. The gun only becomes dangerous when the person handling it is dangerous. And oftentimes we forget that, and you mentioned this earlier, Brother Stovall, about the urban community. One of the reasons there are so many negligent discharges in Black communities is because we're untrained, right? You hear, here's an example. You hear a young guy, he's in a court, and the judge says, "Why did you shoot him?" And the guy says, "I thought the gun was unloaded." Well, anyone who's been trained knows that the first law of gun safety is always assume the gun is loaded until you have dropped the magazine, racked the slide, physically and visibly check the chamber. That's a rule. That's a law. That has nothing to do with, animosity. It has to do with the fact that we're not trained. So I think that's the first thing. The second thing is, until we get to a point where we don't allow terms like gun violence, like DEI, like CRT, be connected to a community, and we're better educated and understand that media and the dominant culture has the ability to use terms that have nothing to do with animosity or separation, but it has more to do with racism and white supremacy, then we're not going to get this thing fixed. Gene Elliott says that racism is a disease, and also it is a public health issue. And so when I think about it historically, I am concerned that we're spending a lot of time trying to take firearms away from people, but we're not spending enough time changing the attitudes of how we deal with, look at, and socialize. So I think that one of the things that we want to begin to pay close attention to is not allowing the dominant culture and the media to use terms like gun violence as a dog whistle. I just heard, and I'll close with this. I just heard a young man refer to Vice President Kamala Harris as a DEI hire and a woman. So now DEI has become a dog whistle, and we have to be careful, I think, as black scholars, to not allow that kind of language to be a part of our conversation unless we're really defining how it actually functions.
Thank you.
Can I respond to that, or should we just hold off?
Sure, go ahead, Brother Jackson.
I think Dr. Stevenson, I think there's some points I really agree with you on. That with every public health crisis, we have to think about not just safety and regulation, but we do have to think about behavior change. So when automobiles was a huge crisis and we were losing so many lives to it, we didn't just change speed limits and walk away. We looked at, okay, how do we think about getting a learner's permit, going through the tests? How do we think about shifting behavior while we make cars safer and driving safer? But we cannot neglect that the gun is part of this problem. Right now we are in a situation where guns are we have saturated our country with firearms. The big difference between the 90s and now, in the 90s we had a huge crisis with drugs and so many other situations, and guns were a big part of that, and we lost so many lives. But in the 90s, we had 100 million guns. Right now, we have over 400 million guns.
Right.
And when we look at the violence, and there's statistics and reports to break this down, only 11% of homicides in the Black community are connected to gangs. Only 30% is connected to another felony criminal activity. What we're seeing right now is not a crisis of bad guys picking up guns and doing terrible things. What we're watching is people who are having petty disputes, arguing over a girl, fighting at a party, bumping to each other at the Super Bowl in Kansas City. We're watching people at a Super Bowl parade, and they pull out their backpack and they have assault weapons, they have drums, they have switches, which can turn a Glock into a machine gun. Right? That's what we're dealing with right now. This is not as simple as, it's not about, no, it is about the guns. Behavior must shift. But when you arm someone who's 13 years old, who's dealing with all this tragedy and the stress of our community, of this country that's placed on our community, and then you put a weapon in their hand that operates like a machine gun with a drum on it. I mean, we just saw the mayor of Birmingham speak out against the assault weapons that are in his community. Mayor Woodfin, who I believe is also a brother of ours, right?
Mhm.
And these young guys were tweeting back at him saying, oh, you can catch these switches too. You got kids in the most impoverished part of town holding weapons of war, And it's not, and I think we can never underestimate what damage and what impact that has on this crisis. We can never underestimate, and we have to also recognize that this is being done by design. These manufacturers and these companies are profiting off of this. There are people sitting on yachts making billions of dollars. Last year, the gun industry made more money than Nike. There are more gun stores in America than there are McDonald's. They are making billions of dollars and they're directly marketing to the fear and the conflicts in our community. And so we cannot underestimate the impact of the presence of firearms that are being flooded into our communities in a very strategic and malicious way.
I think they are marketing to our country. They're not just marketing to our communities. Because I'm a firearm safety instructor, so I hang out with guys who have guns. I know white guys who have 100 guns. You hear what I'm saying? I mean, they have whole rooms with guns. So it's not just our community, bro. And I agree with you, but I said, as I said earlier, it's about how we relate to one another. You're right. You're absolutely right with that. We have to get back to a space where I don't see you as a threat. Right? Where if you step on my shoes, you just stepped on my shoes. Right?
Agreed.
And I'll end with this. But a true person who is carrying a firearm for a defensive perspective knows that is a last resort. That the goal is to leave, to de-escalate, to solve the problem without having to take a life. When you present your firearm, it's because there is nothing else left to do. And that comes from training. That has nothing to do with anything else. And so I agree with you, but I also think that until we as brothers and sisters and people in community can see each other as humans, right? And engage in conversation, it doesn't matter, it doesn't matter what we do. We're always going to have this problem of disrespect, and you just disrespect me, so I got to get the upper hand.
I have a question here, and I feel like I'm listening to Brother Jackson and Brother Dr. Stevenson talk about this. And I'm hearing that there's the truth might be somewhere in the middle here, and I'll pose this question to the two of you. Would it be safe to say that the issue may or may not be maybe less the guns and more of society's relationship with guns? And what makes me ask that question is something that Dr. Stevenson just said. Like he mentioned things like defensive and last resort. And when I think about how and why people carry guns, and I would love to see studies on this, and it's not necessarily my space, but I would love to see studies on this, like why people decide to carry guns. A lot of times in passing and anecdotally, I'll say, I've heard people say things along the lines to protect my property, to protect my family. And it's a lot of defensive language that alludes to the stopping the quote unquote bad guy. Right. So to that point, like, when do we stop making the conversation and the work about, supposedly stopping the bad guy? And this kind of brings in the law enforcement dimension as well. And we start getting to the question of how do we stop societal production of the would-be bad guys? And I think it kind of leads into some of the educational dimensions I'll talk about in a minute. But I want to pose that question to the group because it's just kind of, I was compelled to ask that question just now.
Yeah, I mean, look, I think, let's just be clear. I am a gun owner. I get it. I grew up on a farm. We hunted my entire life. I definitely connect with Dr. Stevenson on the responsible gun ownership, like mentality of really being responsible in how we train, how we own, how we store. But what I think we've been misled by as a community to think that owning guns is a defensive tactic. Guns are primarily an offensive tool. The primary defensive tactic is typically what we call known deterrence.
Go
You know,
ahead.
if you don't want your house to get broken into, the number one thing you should do is deter someone from breaking into your house.
Right.
That means have a fence, have a
Right.
dog, leave your bathroom light on, have a security sign,
Right.
you know, have a car parked out front so it looks like someone's home. The best defense you have is to not have someone break into your house in the first place.
Sure.
Now, if they do break into your house, then yes, that's when you have to use what's called unknown deterrence. You got to protect yourself. You got to fight for your family, all of those things. But right now, we have, in a lot of ways, been misled that we should be armed and strapping ourselves before we're even thinking about deterrence. And the reality is that the guns in the home have become a bigger threat than someone invading your home. I mean, this is the number one cause of death for all youth in America. 75% of school shootings, the guns come from the home. 80% of youth suicides, the gun comes from the home. 76% of accidental shootings of kids, the guns come from the home.
All right, hold on.
So the
Brother.
boogeyman that we should be worried about is not the person breaking in your house. It's the gun you got tucked under your pillow or in your nightstand or in your closet. I mean, that is a much bigger threat statistically to what's happening. And we know our youth in a mental health crisis. We know black youth suicide is the steepest inclining group in America. So our children are literally in a mental health crisis, and we're putting something in our home, which is literally the number one cause of them taking their own life. And we're bringing it in and thinking that's protecting us from some boogeyman. And I think it's just really, really important to see it for what it is. The gun industry is marketing this message and this narrative to us. They are making billions of dollars, and they are pushing this message, whether it's through our music, whether it's through our entertainment, whether it's through magazines. Like, this is not happening by accident. The gun industry is the least regulated commercial industry we have in this country due to a bill called PLACA. And they are literally making billions of dollars off of this concept of fear. And yes, Dr. Stevens is right. They are, Black Lives Matter protest happens, they market to the suburbs and say, you don't want this coming to your block. And then when a police shooting happens, they market to black and brown folks like, hey, you got to protect yourself, take justice in your own hands. They are manipulating this whole concept. And we are falling into this trap of thinking that this is the number one way to defend ourselves. Now, if you're thinking about offense, that's different. But I really think the concept of defense of your family, we really have to make a strong consideration about what the real threat is. And if you do decide to make that decision, then like Dr. Stevenson said, you should be trained. You should have them securely stored and locked up. But right now, it's not as simple as it's playing out. And unfortunately, we're the ones dying from it. You know, how many videos have we seen of some white man breaking in the house and killing black kids? It's not that common statistically, but we are seeing our youth kill each other. And it's not because they're black. It's not because they're impoverished. It's because they're traumatized and they have easy access to firearms. So I'll stand back there.
And most recently, Brother Jackson, the incident that happened in Chicago, just wanted to pivot on that as well, in reference to what you were saying. It's just, it's a tragedy as, altogether. And I believe that we as a society need to come up with, ways on how we can, try to mitigate these occurrences from happening. It's just far too many. I wanted to pivot for a moment and to pose a question to Brother Dr. Holland to discuss education policy and equity in urban school districts and the impact of gun violence. Can you pretty much give me some insights on that, or give the audience some insights on that?
Right. So I'll start by acknowledging that Brother Jackson was reading from my notes, apparently, because he said he touched on a couple of points that I'm going to hit on in my spiel. The social, economic, and political elements that make some environments more conducive to gun violence they're absolutely important. And I'll add to that addressing violence in communities in a long term, if you're going to do that, you cannot avoid addressing how exposure to violence makes its way into classrooms in our country. So, like, we know that urban schools, especially, tend to be more likely to experience gun-related incidents, and a lot of it is tied to higher overall rates of community gun violence. Again, reflection of larger societal issues that have been transmitted to our kids and filter into our halls of learning. So really quick, I just kind of want to touch on some of the effects of exposure to violence in general on our kids, and gun violence notwithstanding. So we start with the cognitive and emotional impacts. So the stress and trauma of exposure to violence, it has a neurological effect that impairs cognitive functions that are essential for learning. So attention, memory, and executive decision-making skills, right? Traumatized students have difficulty concentrating, retaining information, and constructive problem solving. And tied to that, the mental health issues that come with it. So there are greater risks for anxiety and depression, and understandably PTSD is present as well. So these are other issues that interfere with school attendance, engagement, and academic performance. Cool. So what does this look like on the outside? If you're a teacher, if you're a school leader, if you're or a superintendent, even in the aggregate, this looks like two things. Usually kids checking out or wilding out. So when I say wilding out, I mean an increase in aggressive or disruptive behavior. So exposure to violence, it makes kids more prone to the aggressive behavior that results in exclusionary discipline, out of school suspension, and things that are associated with the school to prison pipeline. And once kids get caught up in the school to prison pipeline, increases their chances of being involved or a victim of gun violence or violence of any sort in reality. And on the other side of that, checking out, we have one of the bigger issues that are affecting school systems across the country right now. So it's chronic absenteeism. Education leaders have been asking and researching the components of chronic absenteeism a lot lately because of its impact on academic performance, especially on the heels of the pandemic. But when it comes to violence, kids that don't feel safe don't come to school. Kids that don't feel seen or feel like their teachers and their principals and the administrators in their school don't understand what they're dealing with will check out and not come to school. It's not a place that they want to be. And so, and in the long term, it's a negative impact on academic outcomes. If kids aren't in school, they can't learn. If kids are suspended, they can't learn. They have to be invested in order to produce, right? Nobody's going to take a test if they don't feel like being somewhere. So if on the other side of that, because I'm more of a solutions oriented person, and I'm in the business of trying to develop solutions to issues affecting urban education and especially kids that look like us. Show me healthy kids and I'll show you a healthy school. If you show me a healthy school, I'll show you a healthy community. And I'm going to lean on the sentiments of the executive director of the Council of Great City Schools when he issued a statement on the heels of the U.S. Surgeon General's guidance on firearm violence. He said that urban schools can't reduce gun violence in schools and communities alone, and that the cost of inaction by adults having the wherewithal to make a difference is way too high. To that point, I'll say that, and this is my own opinion and not necessarily that of the fraternity or the Council of the Great City Schools or any of our affiliates, disclaimer here. We saw an unprecedented investment in urban schools as part of the nation's response to the COVID pandemic. Quite a few districts in our major cities are recovering better academically than districts in their respective states. And a couple of districts like Chicago and in my hometown of Philadelphia, they're among the nation's leaders in post-pandemic academic recovery. So imagine a world where those investments which was meant to be, one-offs, or as we address the pandemic-related issues. Imagine a world where these districts that are plagued with community gun violence saw these investments become permanent, and they were able to invest in evidence-based and trauma-informed responses for kids that live in these communities. Programs like the second step program, or promoting alternative thinking strategies curriculum. Like, we get a longer way in, at the very least, disrupting the intergenerational transmission of the trauma that begets more violence. Dr. Stevenson said, dropped a couple of buzzwords in the education space. He said CRT and DEI, but I'll give you another one. So social emotional learning, like SEL, is another one that people slide in there as a dog whistle. But the research on the matter is pretty supportive of what it can do for kids that have seen the type of violence and things that our kids have seen. Turning back to the council's executive director for a second, he also kind of alluded to the role that community networks can play and should play in protecting our kids. Typically, perpetrators of gun violence in schools usually have some affiliation with the school in which they commit their violent act. And a vast majority showed warning signs before committing a targeted act of violence. So a community that understands these signs and makes it clear that schools are and should be safe zones, absolutely essential. That means community education on what these signs are, partnerships with as many stakeholders as we can bring into the mix, and resources to make these investments possible, right? Another thing I'll add is, in the event that a perpetrator of gun violence is a minor, the gun usually comes from the home of the child or the child's relative. That's what Brother Jackson said, was talking about earlier. And at the risk of getting into a whole other debate that we've sort of been nibbling on the edges of, I'll say that, more responsible gun ownership, or more accountability for those that are irresponsible in their exercise of gun ownership rights, absolutely warranted here. If kids that are at risk of being perpetrators of gun violence don't have access to guns, it reduces the likelihood that they will commit a violent act involving a firearm. Won't get us to zero, but I do think it can help. And the last thing I'll say, which again is not resembling anything like an official position of the fraternity or the council, is halting. Another thing that's halting progress on this issue is the inability to examine the issue in earnest. Putting my researcher hat on for a second. Steps should be taken to repeal the Dickey Amendment. So for folks that don't know, the Dickey Amendment is a condition that was added to a government spending bill back in 1997 that said that no government funds should be used to advocate or promote gun control. Now, so for those of us who do policy research or serve as advisors to policymakers, it's a no-win situation. So what ends up happening is the largest public health agencies in the country stayed away from even asking questions about guns until about 5 years ago, right? When people started to say, hey, this might be worth examining a little bit. So we need to remove the political threat that comes with asking hard questions about guns and gun violence in this country. Trying to develop solutions to complicated problems with limited information, never a good look, never a good strategy. And with that, I will yield the floor.
Okay. Brother Enya, and it leads right into when we talk about legislative strategies. It's right in your wheelhouse, Dr. Enya. Can you provide us some perspectives on health equity and legislative strategies and align with Brother Holland?
Yeah, so I'll lead by saying that I feel like my notes have been pilfered by the brothers because there's not much else that I could add necessarily in terms of really what kind of my lane. But I will say that I will put on my Capitol Hill staffer hat, at least to kind of bring some color and some context to the ways in which Black and brown staffers are critical in helping to shape policy on Capitol Hill. I grew up on the south side of Chicago. Okay. My wife went to college in Boston, and she got shot at in college. So this is also personal for me because I've grown up and lived in environments that were conducive to gun violence. I'll say that if you're not at the table, you're on the menu. And I'm going to share some stats as it relates to the ways in which, and this is as a follow-up to what Greg had mentioned about, yes, there has been great work done in a bipartisan fashion to bring us to where we are today in terms of gun safety and all that comes with that. And so, however, because of what we know about history and backlash that can come whenever we as Black people make progress, it's also going to be critically important for us as Black and brown people to play the long and short game. And so, according to the Joint Center for Political and Economic Studies, people of color make up 41% of the U.S. population, but only 15.8% of all Senate's personal office top staff. Blacks account for 13.6% of the U.S. population, but only 2.1% of Senate's personal office top staff. Top staff means the staffers who are literally helping to draft policy and working closely with a member of Congress to draft policy. And those staffers are either the chief of staff or the legislative director or the comms director. So they are key in helping to shape policy. Now, this report that I'm citing, it came out in 2023. None of the Black top staff hired as of January 2020 were retained as of June 2023. Black top staff actually decreased from 3.1% to 2.1% from 2020 to 2023. And so part of my passion has been, how do I help to strengthen and lengthen the pipeline for Black and brown staffers to get to Capitol Hill, who can serve in key positions to apply the pressure consistently to ensure that the gains that have been earned and achieved are maintained and built upon. And so, I'll also note that it is critically important, as we all know, to know how to connect the dots from a civic engagement perspective, voting up and down the ballot every election cycle, not just every 4 years. And the last thing that I'll share is to say that there is a direct connection between the levels of civic engagement and health outcomes, whether those are physical health outcomes or mental health outcomes. There is a plethora of studies that have found that the extent to which voters and/or citizens are involved in the electoral process, in the political making process, it helps to shape the thinking with the elected officials, because if the populace is educated on gun safety and all the other issues that we have discussed, then they are more likely to be involved in going to town halls, Zoom calls, rallies, calling the elected officials, all of those levers that come with civic engagement to get people into office who share similar values, who can keep the pressure up to continue to make progress as it relates to what I call the political drivers of health. So those are some kind of takeaways that I'll kind of share from a legislative policy standpoint, as well as from a grassroots perspective.
That was well said, good brother. I really appreciate your insights and your viewpoints through that perspective. We have about 5 minutes left in closing for our discussion. First importantly, I know we weren't able to gather and summarize all of the key insights as it relates to gun safety. As I always say, that gun violence and gun violence solutions towards this crisis is a multifaceted approach, and understanding the multifaceted approach, there are so many different things that we if we had more time we could loop into. But I would like to thank all of the brothers on the panel that participated in this discussion. Brother Greg Jackson, Dr. Stevenson, Dr. Holland, Dr. Enya. And I'll say that in closing, that this is a never-ending struggle for trying to help to eliminate the gun violence crisis in America, and I'll just close out with that. And I know that the work of Alpha is never done, and so we continue to strive on, seek onward and upward, and look forward towards making tremendous impact and tremendous success, not only through our organization, but in the U.S. and in this country that we serve, and in the public as a whole. So thank you once again, and I will close out with that. Peace be with you all.